This week, our topic is conditions of the respiratory system. To advance these slides, you have to click to go from one slide to the next. I've narrated almost all of them, so you should be able to hear me throughout the presentation. As seen here, the respiratory system includes airways, lungs, the heart, and associated muscles that allow us to take in air and oxygen and supply our cells and muscles. In addition to the supply function, the respiratory system also removes carbon dioxide waste from the body. Conditions that impact the respiratory system may involve the lungs, throat and upper airways, the bronchi, or lower airways. In order to understand this better, it helps to get how the lungs work. So let's go through that real fast. Basically, the air that you breathe goes down your windpipe into tubes in your lungs called the bronchial tubes or airways. Within the lungs, your bronchial tubes branch into thousands of smaller, thinner tubes called bronchioles. These tubes end in bunches of tiny round air sacs called alveoli. Small blood vessels called capillaries run through the walls of the air sacs. When air reaches the air sacs, oxygen passes through the air sac walls into the blood in the capillaries. At the same time, carbon dioxide gas moves from the capillaries into the air sacs. This is where what we call the gas exchange. Now normally, the airways and air sacs are elastic or stretchy, so when you breathe in, each sac fills up with air like a small balloon. When you breathe out, the sacs deflate and the air goes out. So what does it mean when a condition impacts the respiratory system? Really, we have two main problems: low oxygen levels and a buildup of carbon dioxide. So why is this a problem for us? Well, these conditions can result in shortness of breath and trouble breathing, low energy and difficulty moving around, even just walking, and symptoms of coughing and increased mucus production. Conditions of the respiratory system can be divided into a few categories. The first one that we'll go through is infection. Infections of the respiratory system are something that we all likely have experience with, such as laryngitis or pneumonia. TB, or tuberculosis, also is under this category, but thanks to vaccines we don't often come across people in this country with TB, but in other parts of the world it's much more common. So TB is potentially fatal, but is treatable as long as people have access to healthcare interventions. A second category includes what we would consider chronic conditions like asthma, cystic fibrosis, COPD, and sleep apnea. They would all come under this umbrella. COPD, or chronic obstructive pulmonary disease, is a progressive disease that makes it difficult to breathe. Chronic bronchitis and emphysema are both conditions that are considered COPD, and many people have both at the same time. While there are other conditions associated with the respiratory system, today we will focus on the ones listed in this slide and the one previous. First, let's talk about asthma. Asthma is a condition involving the airways, where they contract and are hyperresponsive to environmental and external triggers, resulting in episodic attacks of wheezing, difficulty breathing, chest tightness and coughing, and other associated symptoms. Triggers may range from emotional things like stress or anxiety to environmental things like allergies, smoke, fumes, or perfumes. Here we have a visual of the airways during normal times on the left, and then during a time when someone is having an asthmatic symptom on the right. See how on the right the muscles have constricted and there is additional mucus buildup, making the airway very small, thus making it hard to breathe and causing a coughing reflex as your body tries to get the mucus out of the way. This is what happens when someone's having an asthma attack. While asthma may impact anyone, we do see some disparity across racial groups and income levels. The lines on the bar chart that you see are what we call error lines, and when they do not overlap, it means that a group has a significantly higher rate of asthma. For the most part, the lines do overlap, meaning that while we see some groups with higher asthma prevalence, the differences do not reach what we would consider to be a statistically significant difference. However, for individuals who are multiracial and those from a Puerto Rican background, we do see significantly higher rates. Also, income levels show that those who are below 100% of the federal poverty rate have a higher incidence of asthma. That link on the bottom takes you to the CDC website for more incidence figures like this. Asthma ranges from mild, where a person may only have symptoms periodically, such as during allergy season or while exercising, to severe, where a person may have symptoms most or all of the time and require maintenance medications on a daily basis to prevent symptoms, along with inhalers or nebulizer type treatments as quick relief for asthma attacks. Asthma attacks do have the potential to be fatal. Doctors recommend that people with asthma have a care plan in place, and for a child that the school is aware of this care plan, to address an asthma attack should one occur. This might include avoidance of triggers, doctor's numbers, a history of symptoms, and other information that may be useful in an emergency. Asthma, when considering work options, may come with some environmental considerations, such as avoiding things that are known to be environmental triggers, extreme temperatures, and allow for treatments as needed. Moving on to cystic fibrosis. This is a genetic condition that affects both the lungs and the digestive system. Cystic fibrosis, or CF, impacts about 30,000 children and adults in the U.S. and about 70,000 worldwide. While life expectancy rates as recently as the 1950s were only a few years, most children never lived to attend school. With improved treatment, they have risen to the early 40s. This is still, although an improvement, drastically shorter than the average adult. As I mentioned, CF is a genetic condition, but unlike some of the others we have studied previously, it is not what we call X-linked and does not have a gender component. The Cystic Fibrosis Foundation provides us with this diagram of inheritance patterns, and we see that in order for a child to have CF, they must inherit a carrier gene from each parent. Genetic testing is available, and newborns are typically screened for CF. Now, this screening won't confirm a diagnosis, but can indicate a need for follow-up testing to get a diagnosis. One follow-up test is called the sweat test, where salt concentrations are tested in the skin and sweat. This is because a leading symptom of CF that is unrelated to lung function is a high concentration of salt on skin or in the sweat. Here's just a quick list of symptoms and treatments for CF, just again from that same nursing resource that we've used before. Some of the more common characteristic symptoms of CF include the following: very salty tasting skin and sweat, just like we talked about, persistent cough and frequent lung infections, wheezing and shortness of breath, poor growth despite good appetite due to trouble absorbing nutrients, and the digestive symptoms, including irregular stools and difficulty in bowel movements. Some of the more problematic symptoms are of course related to lung function and health, thick mucus making it difficult to breathe, and the digestive problems making it hard for people to get full nutritional benefit from their food. The treatments, which we will go over next, address these issues. Most people with CF will utilize a combination of treatments, including mucus thinners, airway clearance techniques, antibiotics, and nutritional and digestive support. Airway clearance techniques include having someone clap your back to break up mucus through force, but also might include devices that also serve this purpose. Medications and antibiotics may be inhaled, taken orally, or through an IV or pump. Wellness and alternative therapies include exercise to keep lung capacity up, and nutritional support to ensure that people can derive the full nutritional benefits from food, maintain a healthy weight, and so forth. Since there's currently no cure for CF, we talk about living with CF, and that includes adherence to the treatments to maintain health and lung function and avoid infection, but also managing some emotional issues related to having a severe and chronic illness that comes with a markedly shorter life expectancy. Missy Ayers, who is an advocate and fundraiser for the CF Foundation, talks about what having CF means for her. I encourage you to pause the presentation. Don't worry, I'll still be here when you get back so that you can listen to her speak. Next, we'll review COPD. And remember, this is the group of conditions with common symptoms. For example, shortness of breath and difficulty breathing, the overproduction of mucus, limited airflow, and chronic lung inflammation. COPD is currently the third leading cause of death in the U.S., according to the CDC 2011 figures. In addition, it was the only condition in the top 6 to have an increase in prevalence rather than a decrease or no change. The other conditions with an increase in the top 10 were diabetes and flu pneumonia. Leading risk factors for COPD are smoking. 80 to 90% of people who have COPD are smokers or are former smokers. And environmental and genetic factors, including a history of chronic infections, low SES, and exposure to toxins. As we said earlier, COPD includes both chronic bronchitis and emphysema, and some people have both. The symptoms and impacts of these conditions are similar, so we usually consider them together. So what exactly is going on with the lungs in emphysema? With emphysema, the walls between many of the air sacs are damaged. As a result, the air sacs have lost their shape and become floppy. This damage can also destroy the walls of the air sacs, leading to fewer and larger air sacs instead of many tiny ones. If this happens, the amount of gas exchange in the lungs is reduced. In chronic bronchitis, the lining of the airways is constantly irritated and inflamed. This causes the lining to thicken. Lots of mucus forms in the airways, making it really hard to breathe. COPD is a major cause of disability, and it's the third leading cause of death in the United States, as we just said. Currently, millions of people are diagnosed with COPD. Many more people may have the disease and not know it. This is because COPD develops slowly. Many people don't become diagnosed until they have lost half of their lung function or more. COPD stage is really measured based on how forcefully someone can exhale. If you've ever been in the hospital and had to have surgery, you may have been given the sort of game that's used to gauge and increase lung function. It's a small device usually that you exhale into. The reason I say it's like a game is because you have to keep the ball up in the air with your breath, and you're supposed to do it for longer as you heal. This is the same idea with exhalation force. How hard and how consistently you can blow air out is a measure of your COPD stage. This CDC map shows that, along with other chronic conditions that we've talked about, Kentucky has a higher than average age standardized death rate for COPD. You can click on the links at the bottom to learn more about this, including the work-related lung disease surveillance system. Like some of the other conditions we've talked about, lung damage is irreversible, so the goal of treatment is to maintain quality of life and slow disease progression. Often symptoms are treated and people are encouraged to make positive life changes that will enhance their functional capacity and limit complications. Some good examples are quitting smoking, exercising, and other wellness approaches. Some of the more common methods of treating COPD are displayed in this chart, including wellness education, pulmonary rehabilitation, oxygen, or even surgery as the disease progresses. On the next slide, I'll go through what each of these means a little bit more detailed. Pulmonary rehabilitation may be a new term for us. So what that is exactly is a multidisciplinary approach targeted at maximizing our ability to live with a condition, specifically a lung condition. It includes a combination of education, exercise, counseling, energy conservation, and physiotherapy. Surgery may be required, and what that would include could be a lung transplant or a lung reduction, where a section of damaged lung tissue is removed. Something that's better known in this part of the country than some others, just because it's more common due to things like the coal industry, are occupational lung conditions resulting from inhalation of dust like coal dust or metal quartz dust or asbestos. These conditions lead to scarring of the lungs and a heightened risk for lung cancer. I have posted some additional materials about occupational lung conditions that you might find interesting, particularly related to how quickly this damage actually can occur. Apnea often co-occurs with other conditions and really means the cessation of breathing. Now, sleep apnea is a pretty common form of apnea that people wake up in the middle of the night because they've stopped breathing. This can affect their sleep and rest to the point where an individual cannot function well during the day. It's considered a restrictive pulmonary condition. Treatments for apnea often include the following: losing weight. 70% of people with sleep apnea are overweight. Applying nasal decongestants, positional therapy, for example, learning to sleep on your side, a surgery to remove an airway blockage, or an oral appliance, sort of like a mouth guard, so you're repositioning your jaw to keep your airway open. Some people who have sleep apnea benefit from using airway pressure devices. If you're unfamiliar with sleep apnea, I suggest you watch the supplementary video at the bottom where they explain a sleep study and what happens to a person after having a sleep study and receiving a diagnosis of sleep apnea. You can pause this presentation to watch the video and then come back. Here are some potential psychosocial impacts of respiratory conditions. For one, there's an acute nature of being unable to breathe that is frightening and can be life-threatening. Aside from this, having limited activities of things that you weren't once able to do, possible depression or anxiety, having a cloudy head due to continually low oxygen levels, having a changed role with family and friends, and potential limitations on a person's social life. Vocationally, a person may need to alter his or her work environment or change to a different place of employment to avoid things like triggers, pollutants, or other things that might make a person's condition worse. There could be some legal issues, for example, a workers' comp case, related to the work environment and pollutants. Finally, there's a possible reduced capacity for physical activity at work that may require something like a job modification or accommodation. You might be thinking, she really didn't talk about vocational and psychosocial impacts very much at all compared to what we usually do. Well, you're right. Since we're not in person to have a discussion this week, I would like you to do the following. Select one of the psychosocial or vocational impacts suggested, or come up with another one that you thought of that I didn't, and look into it more. Think about it. For example, you might decide to do a little research on COPD and the social impact. Go back to the posting board and Blackboard and explain to your peers why this is an issue. That's part 1. Then, review someone else's explanation of a different kind of impact and make a comment. Try to pick something different than the rest of the class, so before you start, go to the board and see what other people have covered. I'll be participating from a distance and looking in to see how you guys are doing.